A $2 bottle sitting on the natural health shelf in every grocery store restores hair as effectively as the most commonly prescribed hair loss drug on the market. Not nearly, not somewhat, but exactly the same results. A randomized controlled trial published in a peer-reviewed dermatology journal compared it directly to 2% minoxidil. After 6 months, hair regrowth scores were identical, with 0 side effects from the $2 bottle, unlike the documented side effects of an $80 monthly prescription. Ancient Greek and Roman doctors recorded this botanical treatment for hair loss over 2,000 years ago. Physicians from the Islamic Golden Age even included it in pharmacological texts. In 2015, a research team confirmed through clinical study that ancient observations were accurate. The global hair loss market generates over $3.6 billion each year. Minoxidil, finasteride, DHT blocking supplements, hair transplant surgeries, laser devices, and platelet-rich plasma therapies dominate this space. All require continuous use or repeated treatments. A $2 bottle of botanical oil achieving the same effect as the leading pharmaceutical treatment threatens every minoxidil bottle, every finasteride prescription, and every expensive hair transplant consultation. Its use did not stop because it failed. Discussion about it stopped because a clinical trial verified its effectiveness, and the economics of a $2 product conflict with a $3.6 billion industry. This is the story of rosemary oil, the 2,000-year-old remedy for hair thinning buried by industry. The plant is Rosmarinus officinalis, rosemary. It grows along the Mediterranean shores, rocky hills of southern France, coastal cliffs of Spain and Italy and Greek islands. Its name means dew of the sea in Latin. For millennia, civilizations in these regions recognized its medicinal value. The earliest documented use of rosemary for hair loss appears in Greek and Roman texts from the 1st and 2nd centuries. Dioscorides, a Greek military physician, recorded rosemary preparations to stimulate hair growth and treat hair loss conditions. His writings reflected treatments actively applied by Roman doctors to achieve measurable results. Galen, whose work influenced European and Islamic medicine for over 1,000 years, mentioned rosemary for scalp health and hair stimulation. Wealthy Roman women included rosemary-infused oils in their hair routines. Rosemary's association with hair wellness continued through the fall of Rome into medieval Europe. Herbalists consistently documented its use for thinning and hair loss, showing results that stood the test of time. During the Islamic Golden Age, physicians translated and expanded Greek and Roman medical works. Ibn Sina documented rosemary's benefits for scalp circulation and hair retention. By the 14th century, a famous preparation called Hungary water, one of the first alcohol-based perfumes and medical treatments in Europe, was mainly made from rosemary. It was prescribed for hair loss, scalp problems, and circulation issues. Queen Elizabeth of Hungary used it, and it spread through European courts as a luxury remedy. Its effectiveness was widely accepted for 2,000 years, raising the question of why modern dermatologists rarely prescribe it. The reason is economic, not scientific. In 1988, the FDA approved topical minoxidil for hair loss. Originally a blood pressure drug, it had hair growth as a side effect. The topical version was patented. 2% minoxidil sold over the counter, 5% required a prescription. Daily use was mandatory indefinitely, and hair loss resumed quickly if stopped, creating a subscription model. Meanwhile, rosemary oil, used for 2,000 years and proven in a clinical trial to match pharmaceutical results, remained on the natural health shelf as a culinary herb. No pharmaceutical company funded trials to prove a $2 bottle worked as effectively as an $80 monthly product. Hair thinning in most men and women stems from 2 main mechanisms. The first is sensitivity to DHT, dihydrotestosterone, a testosterone metabolite produced by the 5-alpha reductase enzyme. Hair follicles sensitive to DHT shrink over successive cycles, producing progressively thinner, shorter hairs. Eventually, follicles cannot produce visible hair, leading to androgenetic alopecia, the most common hair loss type affecting over 50% of men and around 30% of women by age 50. The second mechanism is reduced scalp blood flow. Hair follicles are highly metabolically active and need constant oxygen, nutrients, and growth factors delivered by capillaries. Thinning areas show reduced capillary density, causing follicles to spend less time growing and more time in resting phases. Hair falls at normal rates, but is not replaced properly, resulting in gradual thinning. Rosemary oil combats both mechanisms at once. Its active compounds, rosmarinic acid, carnosic acid, carnosol, and 1.8 cineol, demonstrate measurable effects on DHT metabolism and scalp microcirculation. Carnosic acid and rosmarinic acid strongly inhibit 5-alpha reductase, the enzyme that converts testosterone into DHT. By blocking 5-alpha reductase, rosemary oil lowers local DHT levels in the scalp without altering systemic hormones. This is the key difference from finasteride, the pharmaceutical 5-alpha reductase inhibitor that reduces DHT throughout the body. The systemic reduction of DHT from finasteride causes documented side effects: sexual dysfunction, decreased libido, mood changes, and post-finasteride syndrome. Rosemary oil's inhibition occurs only in scalp tissue where applied. The overall hormonal system remains unaffected. Side effects linked to systemic DHT reduction do not occur. 1.8 cineol, also called eucalyptol, drives rosemary oil's effect on scalp blood flow. It is a powerful vasodilator. When applied to the scalp, it widens capillaries in the dermis, enhancing blood flow to hair follicles. Increased circulation delivers more oxygen, nutrients, and growth factors to the follicles. Dormant follicles, due to poor blood supply, are reactivated into the growth phase. In 2015, researchers in Iran published a randomized controlled trial in the journal Skin Med comparing rosemary oil to 2% minoxidil for androgenetic alopecia. 100 patients with confirmed androgenetic alopecia were randomly assigned to receive either rosemary oil or 2% minoxidil applied twice daily for 6 months. Both groups were blinded to the treatment. Hair counts at marked scalp areas were measured at baseline, 3 months and 6 months. At 3 months, both groups showed modest improvements with no significant difference. At 6 months, both groups experienced substantial increases in hair count from baseline. The difference between groups at 6 months was not significant. Rosemary oil produced hair regrowth identical to 2% minoxidil. Participants using rosemary oil reported less scalp itching, a common minoxidil side effect. No other side effects appeared. $2 versus $80 per month. Identical results. 0 side effects from the $2 option. The study was published, yet hair loss guidelines did not change. The global hair loss market makes over $3.6 billion annually. Minoxidil, finasteride, DHT blocking supplements, hair transplants, laser devices, and clinic treatments drive revenue. Every segment relies on the assumption that hair loss needs ongoing pharmaceutical or procedural care, not a $2 botanical oil used for 2,000 years. Minoxidil must be applied daily without end. Hair regrown from its vasodilatory effect falls out within 3 to 6 months if use stops. Follicles return to dormancy once stimulation ends. This is not a side note. It is the core economic fact of the minoxidil business. A patient starting minoxidil at 30 and maintaining hair into their 60s buys 30 years of monthly product at $60 to $80 per month, totaling $21,000 to $28,000 per person over 3 decades. Rosemary oil works differently. 5-alpha reductase inhibition from rosmarinic and carnosic acids alters local scalp DHT. Regular vasodilation improves capillary density, creating structural changes in scalp microcirculation. These effects are longer lasting than the functional vasodilation of minoxidil. Users who maintain rosemary oil as part of scalp care often see continuous improvement instead of the plateau and depend cycle seen with minoxidil. The rosemary oil market cannot be protected. Rosmarinic acid and carnosic acid are natural compounds. Rosemary has grown in the Mediterranean since before the Roman Empire. No company can patent it or build a subscription model around it. When the 2015 Skin Med trial confirmed rosemary oil matched 2% minoxidil, the hair loss industry responded with silence. No dermatology guidelines were updated. No clinics recommended it as first-line treatment. Mainstream media did not report a $2 oil matching a pharmaceutical product in a clinical trial. The study remained in academic journals, visible to researchers and patients, but with no financial incentive for the industry to promote it. The knowledge persisted. It survived in natural hair care communities, Ayurvedic practices, and among people who discovered the 2015 trial and followed its protocol. The trial by Panahi and colleagues has been cited over 200 times in academic literature, referenced in systematic reviews of natural hair loss treatments, and discussed in integrative dermatology publications. It remains one of the most robust clinical studies supporting any natural hair loss remedy. Most people experiencing thinning hair have never heard of it. In evidence-based natural hair care communities, the Panahi trial is well known. Users applying rosemary oil twice daily to thinning areas for 6 months consistently report results matching the trial. A dermatologist at a university medical center in the United Kingdom noted in 2016 that rosemary oil offered an evidence-based option for mild to moderate androgenetic alopecia with clinical trial support. She observed that its absence from standard guidelines was due to commercial factors, not lack of evidence. Natural plant oils cannot navigate pharmaceutical approvals or make therapeutic claims without them. They remain in natural health aisles, while approved products occupy pharmacies. Over 4 years of patient monitoring, the outcomes remained aligned with the clinical trial findings. Patients who consistently followed the protocol for 6 months showed improvements in hair density comparable to those seen in people using minoxidil. The difference was the absence of scalp irritation, no initial shedding phase that causes many users to quit minoxidil within the first weeks, no dependency cycle, and no $80 monthly expense. The protocol itself comes directly from a published randomized controlled study. Not folklore, not anecdotal evidence. A peer-reviewed clinical trial that achieved results equal to pharmaceutical treatment. First, obtain 100% pure rosemary essential oil, not rosemary-infused carrier oils, not scented cosmetic hair products. Pure Rosmarinus officinalis essential oil. The active compounds, rosmarinic acid, carnosic acid, and 1.8 cineol, exist in concentrated form only in the essential oil. Diluted infusion products do not contain therapeutic concentrations. A 15 milliliter bottle of pure rosemary essential oil costs between $8 and $15 from natural health retailers. At the recommended usage level, one bottle lasts around 60 to 90 days. Next, dilute the essential oil before use. Essential oils are too concentrated for direct scalp application. Applying undiluted rosemary oil can irritate the scalp and damage follicles. The Panahi trial used a carrier oil blend. Combined 6 drops of rosemary essential oil with 1 teaspoon of carrier oil. Jojoba oil is considered ideal because its molecular structure closely resembles sebum, the scalp's natural oil, making it highly compatible and non-comedogenic. Coconut oil is also effective and adds antimicrobial properties. Any neutral carrier oil is acceptable. Apply the diluted mixture to thinning areas twice daily, once in the morning and again in the evening. This matches the application schedule used in the clinical study that produced results equal to minoxidil. Using fingertips, work the diluted oil directly into the scalp where thinning is visible. Massage gently for 2 to 3 minutes. The massage matters. It spreads the oil evenly across the scalp and helps it reach follicle openings. The massage itself also stimulates circulation, adding a mechanical vasodilatory effect alongside the chemical vasodilation from 1.8 cineol. Combined chemical and mechanical stimulation creates stronger circulation enhancement than either method alone. Leave the oil on the scalp after application. Do not rinse it away. The active compounds require time to penetrate follicles and scalp tissue. If daytime oiliness feels uncomfortable, apply the morning treatment to dry hair before styling normally. The amount used is small enough that properly styled hair should not appear greasy. Continue washing hair normally. The protocol does not require changing washing frequency. Wash hair as usual and apply rosemary oil only after washing and drying, never before. Maintain the routine for a minimum of 6 months. That was the duration used in the clinical trial. Hair growth cycles move slowly. Follicles reactivated from dormancy need weeks before producing visible hair. Newly produced hair also requires time to grow long enough to become noticeable. Improvements in capillary density from repeated vasodilation develop gradually over months. Results should not be judged at 2 months. The study showed modest improvement at 3 months and significant improvement at 6 months. 6 months is the required timeline. During months 1 through 2, the scalp environment begins changing. DHT levels in scalp tissue decline. Capillary density starts improving. Visible changes are usually absent. By month 3, some people notice reduced shedding. Fine vellus hairs can appear in thinning regions. These indicate dormant follicles beginning to reactivate. During months 4 and 5, vellus hairs become thicker terminal hairs. Hair density in thinning areas begin visibly improving. At month 6, the clinical trial endpoint showed statistically significant hair count increases from baseline, matching 6 months of twice daily 2% minoxidil use. The total cost for a 6-month treatment course producing clinically proven regrowth results is approximately $40 to $60 for 3 to 4 bottles of rosemary essential oil. Compare that with 6 months of minoxidil at $60 to $80 per month, totaling $360 to $480 for a product requiring indefinite use to maintain results. Rosemary oil achieved identical outcomes at a fraction of the cost, while its mechanism, improved capillary density and reduced local DHT, may create effects that do not disappear immediately after stopping. Every civilization living near rosemary and facing hair thinning reached the same conclusion independently. Greek physicians in the 1st century documented it. Roman women added it to their hair care routines. Islamic physicians created pharmacological writings around it. Medieval European herbalists recommended it for hair loss. All arrived at the same answer because the answer already existed, growing naturally along Mediterranean coasts, and containing the exact compounds required for scalp circulation and DHT regulation. Rosmarinic acid has no brand name. Carnosic acid carries no patent number. 1.8 cineol requires no prescription. Hair thinning has been reversible for 2,000 years using a substance costing $2. Then, in 2015, a randomized controlled trial placed the evidence into a peer-reviewed journal available for anyone to read. What changed was not the science. What changed was the industry built around convincing people that treatment required $80 each month and lifelong dependence. A $3.6 billion hair loss market depends on consumers never finding the 2015 SkinMed trial and never walking into the natural health aisle to choose a $2 bottle of rosemary essential oil instead of seeking a minoxidil prescription. If this information changed the way you view thinning hair and the inexpensive bottle sitting a few aisles from the pharmacy, share this story with others searching for answers. More people discovering the research means more people learning about evidence that has existed for years. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.